Pharmacogenomics and personalized medicine with 4 answer choices and explanations. Pharmacogenomics and personalized medicine clinical vignettes. 1. Warfarin sensitivity, CYP2C9 and VKORC1. A 62-year-old woman starts warfarin for atrial fibrillation. Her INR rises rapidly despite a low dose. Genetic testing reveals a mutation in CYP2C9. What is the most likely consequence? A. Increased warfarin clearance. B. Decreased warfarin metabolism. C. No effect on warfarin dose. D. Increased vitamin K recycling. Answer B. Decreased warfarin metabolism. Explanation: CYP2C9 3 polymorphisms reduce warfarin metabolism, increasing bleeding risk. VKORC1 mutations also affect sensitivity. 2. Clopidogrel, CYP2C19 polymorphism. A 55-year-old man with a recent MI is given clopidogrel. Genetic testing shows he is a CYP2C19 poor metabolizer. What is the risk? A. Increased risk of bleeding. B. Increased risk of stent thrombosis. C. Increased risk of hepatotoxicity. D. Increased risk of myopathy. Answer: B. Increased risk of stent thrombosis. CYP2C19 activates clopidogrel. Poor metabolizers, 30% of Asians, fail to generate active drug, leading to poor antiplatelet effect. 3. Thiopurine drugs, TPMT deficiency. A 9-year-old boy with acute lymphoblastic leukemia, AL, is started on 6 mercaptopurine. He develops severe bone marrow suppression. What enzyme deficiency should be considered? A. Dihydropyrimidine dehydrogenase, DPD. B. Thiopurine methyltransferase, TPUGT1A1. D. CYPD6. Answer: B. Thiopurine methyltransferase, TPMT. Explanation: TPMT deficient patients have impaired thiopurine drug metabolism, leading to excessive toxicity, myelosuppression. 4. 5-fluorouracil, 5-FU toxicity, DPD deficiency. A 50-year-old woman with colon cancer is treated with 5-FU chemotherapy. Within days, she develops severe diarrhea, neurotoxicity, and myelosuppression. Which enzyme is most likely deficient? A. Dihydropyrimidine dehydrogenase, DPD. B. UGT1A1C, CYP2C9 di. Answer A. Dihydropyrimidine dehydrogenase, DPD. Explanation: DPD deficiency prevents 5-FU breakdown, leading to severe toxicity. Testing for DPD mutations before treatment is recommended. Codeine, CYP2D6 ultra-rapid metabolizer. A 28-year-old woman is prescribed codeine for postpartum pain. Within hours, she becomes sedated, hypoxic, and confused. What genetic variation is responsible? A. CYP2D6 poor metabolizer. B. CYP2D6 ultra-rapid metabolizer. C. CYP3A4 overexpression. D. ABCB1 transporter mutation. B. CYP2D6 ultra-rapid metabolizer. Explanation: CP2D6 converts codeine to morphine. Ultra-rapid metabolizers generate excessive morphine, leading to overdose symptoms. 6. Isoniazid toxicity, Na2 slow acetylators. A 45-year-old man with latent tuberculosis starts ISO-NIH. Weeks later, he develops peripheral neuropathy. What genetic trait increases his risk? A. NAT2 slow acetylator. B. HF701 mutation. C. CYP2C9 polymorphism. D. UGT1A1 deficiency. Answer: Explanation: slow acetylators, common in Europeans and Africans, have slower INH metabolism, increasing neurotoxicity risk. 7. Abacavir hypersensitivity. HLA-B to 5V701, a 38-year-old man with HIV is prescribed Abacavir. He develops fever, rash, GI distress, and malaise within days. What is the likely genetic factor? A. CYP2D6 polymorphism. B. HF701 mutation, CUGT1A1 deficiency. D. CYP2C19 poor metabolizer. Answer: B. HLA-B5701 mutation. HLA-5701 is associated with severe Abacavir hypersensitivity. Patients should be screened before treatment. 8. UGT1A1 and Irinotecan toxicity. A 61-year-old man with metastatic colorectal cancer is treated with Irinotecan and develops severe diarrhea and neutropenia. What genetic deficiency should be considered? A. CYP3A4 mutation. UGT1A1 polymorphism. C. CP2D6 poor metabolizer. D. TPMT deficiency. Answer: UGT1A1 polymorphism. Explanation: UGT1A1 28 mutation reduces Irinotecan metabolism, increasing toxicity. 9. Statin-induced myopathy, SLCO1B1 variant. A 52-year-old woman with hyperlipidemia is started on simvastatin. After 2 weeks, she develops severe muscle pain and elevated CK levels. What is the likely genetic cause? A. CYP2C9 mutation, B. SLCO1B1 polymorphism, C. NAT2 slow acetylator, D. HLA-B 1502 mutation. Answer B. SLCO1B1 polymorphism. Explanation: SLCO1B1 encodes an OATP train transporter responsible for hepatic statin uptake. Mutations increase statin levels, causing myopathy. Carbamazepine and Stevens-Johnson syndrome, HLA-B 1502. A 33-year-old Asian woman is prescribed carbamazepine for epilepsy. Within days, she develops fever, widespread blistering, and mucosal ulceration. What genetic test could have predicted this? A. CY3A4B, HLA-B star 1502, C. NAT2, D. CY2C9. Answer B. HLA-B. Explanation: HLA-B 1502 is strongly associated with SJS10 in Asians taking carbamazepine. Screening is required before starting therapy. Key takeaways for pharmacogenomics and personalized medicine: CYP2C9 and VKORC1, warfarin metabolism and bleeding risk. CYP2C19 Clopidogrel activation, poor metabolizers have clot risk. TPMT deficiency, thiopurine toxicity, e.g. Thiopurine. DPD deficiency, 5-FU toxicity, severe myelosuppression, neurotoxicity. CYP2D6 ultra-rapid metabolizer, codeine toxicity, excessive morphine levels. NAT2 slow acetylator, Isoniazid neurotoxicity and hepatotoxicity. HLA-B 5701, Abacavir hypersensitivity, HIV drug. UGT1A1 polymorphism Irinotecan toxicity, severe diarrhea, neutropenia. SLCO1B1 variant, statin-induced myopathy. HLA-B carbamazepine-induced SJS, SPIN in Asians. Would you like